So your vagina can actually get shorter over time. It's actually a thing. Hi, I'm your local OBGYN. I love women, and let's talk about it. So here is the deal. There are some risk factors that you may have experienced, or maybe in your future that can actually lead to vaginal shortening. All right. Now, the obvious one that somebody might think of is if they've had a hysterectomy, especially if it is below the cervix, what you do is you are actually kind of like taking the roof off of the vagina. So you are losing some length. In addition, if you've had any pelvic surgeries in that area for like a prolapse or something else, there could be vaginal shortening associated with it as well. Now, for women that have had cancer, they may have had some sort of pelvic radiation or radiation close to that area. And in those scenarios, radiation really beats up the blood flow to that area and it kind of like turns everything, it shrinks it down, and you lose some blood flow to those areas. So, therefore, the tissue kind of shrivels up a little bit. And then the obvious one is the menopause. So, when you go through menopause and you lose estrogen, and if you're not using it, especially, that is when that tissue gets a little bit tighter, a little bit firmer, and it gets a little bit more uncomfortable. And then it can kind of feel like it has shrunk down. Now, is this a forever thing? Usually not. With adding back estrogen, sometimes vaginal dilators, you can see a big difference in both the length and the width of the area. Very rarely do people need to do a bigger surgery to kind of like open the space back up.